Hi, good afternoon, everyone. Um, can anybody see me? We're live right now. So this is a 1 week delay of our monthly live stream. My name is Dr. Helene Nguyen from Feet and Beyond in Hackettstown, New Jersey. So today, it just technically it's gonna be the last streaming event for this year, because next month we're gonna have all the holidays coming up, and we at the office we also wrap up for the year, and we're planning for 2022. So hope that everybody's all ready. I know this year is coming really quickly with the holidays. Uh, due to past after I would say post pandemic that we are having all the activity and try to get back to the normal. So just real quick, like at the end of the year, that a few wrap up things that I would like to share with everyone that who've been follow us on Facebook and any social media platform. That usually around Thanksgiving time is a season for giving. So we do have a lot of contests going on. We have a lot of prizes and anything that we can share to community. So just make sure to check out with our website and follow us on Facebook, Instagram, even show Google or YouTube. That we're gonna have a pop-up like contest, and that will be able to give gift cards and all different very cool prizes that we're gonna give out toward the end of the year. Okay, so just that a little heads up, and that is some announcement that I have for our office toward the end of the year. So just to kind of like a little reminder of everyone that who concerned about their feet when time to the cold weather and all the conditions that may exacerbate or getting worse throughout the holiday. So that a few tips and that I want to share so that you don't let the holidays um, your feet get affected with the holiday season and enjoy your holidays with your family and friends. Okay, so a few things that as the weather get colder, that I would like to make sure that everyone that to aware that you think it's cold weather, you wear closed toe shoes, but you don't need to use moisturizer on your feet. It's actually is a myth. So during the winter time, our feet is actually get drier, the skin on our feet get drier compared to the summertime. Why is that? Because it's such a different temperature inside our house and outside. So when the body is not easily adapt to that temperature change, it's actually will have a reaction on the skin itself, and there's actually a tendency to be drier even though you've been wearing your closed-toe shoes the whole entire season. So keep an eye on that. Any after shower, my recommendation will be using any foot cream or moisturizer to on your feet, not between your toes. What happened is when you put on cream and you put sock on, and the feet gonna be get warmer, and it's gonna create all those extra cream gonna create the moisture between your toes, and which gonna could be potential to make a cut on the skin, and it break down, and it leave the opening for the germ or bacteria to get inside the area. So just keep in mind about that, a little tip there. So make sure you moisturize your feet, top and bottom, but not between your toes. And in particular for the patient with people, not patient, but people with any metabolic problem like diabetes, high blood pressure, swelling on the feet, is more crucial for them not to use any cream between the toes. Okay. So my next other thing that I would like to share is a supportive footwear. So during the winter time, that we gonna be wearing boots, we gonna be wearing sneakers, and with snow season, that we want to wear some a different higher boot or different regular than compared to a fall time boot. So those kind of material to make that boot is very thick, and sometimes may not be contoured to the feet properly. So I would advise make sure that when you wear those boots, make sure that the tip of your toes, not touching the tip of the shoes itself. So if you wear your feet, the boots, and you feel that the toes is touching the tip, that means the shoes or the boots are too small. So make sure that keep an eye on that, because when we wear those boot time, the time for the season to wear boots, that we had to wear thicker sock as well. So it adding to the, the thickness and the bulkiness inside the shoes and the boot itself. So those are something, sometimes we don't may not think about it, but to maintain the healthy feet throughout the whole day, I would recommend to have a little bit of wiggle room inside the shoes or boot that will be able to help. Another tip that I would like to advise or for those who are concerned about their feet, especially diabetic patients, patient with circulation issues, patient with high blood pressure issues, tendency to swelling on the feet, let's make sure check in with the foot doctor or podiatrist nearby. Because around this time of the year that we do have a fair amount of patients coming in and call us up, because throughout the whole entire year they never think of something potential can happen. But because of the winter time, the circulation is going to be a concern. The diabetes condition is also going to be a concern, because during the holiday we may not keep track with our diet, so our blood sugar, a tendency to fluctuate. So when it's fluctuated like that, is may potential create some of the condition will be complicated from the uncontrolled diabetes. Okay, so those just one of those friendly reminder is for those people who have a metabolic or systemic problem like diabetes, neuropathy, circulation issues, heart conditions, or high blood pressure conditions. So those is very something to be looked out for. And another the thing that I would like to just to give some per on the patient with like always concerned about toenail, how long the toenail should be. So during the summertime, we kind of like have wear our open toe shoes, right? So we constantly looking at our feet. So as soon as our toenails get a little longer, we tendency to take care of it right away. But when we wear closed toe season, the closed toes, how often we look at our feet? We may not, because we don't really, the term is like outside, out mind. So when we don't pay attention to that, and if those toenails get a little bit longer than expected, and when a person wears shoes with boots and everything and standing long hours, then it can be potentials of causing of the ingrown toenail, fungal infections on the toe, on the toenail itself. So those are something that can be a lookout for in terms of the toenail condition. And one, which is October is a big cancer awareness. Not just about breast cancer, but cancer of all different type of cancer. And definitely one of the things why, as a podiatrist, why I need to talk about cancer itself. We do see cancer lesions on the skin, and most of the time when we see patients in the office, they have a really non-symptomatic, which is like no sign or symptom that relate to the lesions on their feet. And if you know that most of the time we don't really aware of what's going on with our feet, but when there is a lesion on the feet, that is something is going to be mindful about, because it can be very dangerous. There are skin conditions or skin cancer can be detected through the lesions, or just simple routine foot evaluations. Most of the time that we don't see that often, but there are often enough that we can be prevented by when we see that those lesions, we be able to biopsy and come to find out that can be, most of the time it's not malignant, but if it's malignant, it can be very devastating as a result. So, any lesion that you see on your feet, it could be with you for a long time. We don't know what it is until we actually biopsy and find out the result. Lesions on feet is not like lesion on your hand, your shoulder. That's somewhere is more visible for us to be on the lookout for. So if any time that notice any changing of lesion on the feet, is always something to worth look into a professional to check it out. And the best way to do is a biopsy. It's just a simple, very simple procedure. It's in-office procedure, It can be done just a local anesthetic, inject right into the lesions, and that can be just take a little portion of the lesion and we send to the lab, and they'll be able to detect a lot of different disorder or possible is an abnormality about the skin conditions. So those are the, I would say, like, 5 things I always, my rule is that everything's come with 5. So 5 things I would like everyone to be aware of. We're gonna start out with moisturizing the skin, the feet, and make sure everything is all hydrated. Supportive footwear to prevent any of malfunction of the foot structure that can aggravate with foot pain. Is affecting the walking and standing capability. Routine follow-up with a podiatrist, a local professional. Just make sure that your feet is in good check for those who have systemic problem. That will be a concern when it comes to the closed-toe season. The toenails is always keep is all in short and decent length to prevent any of the ingrown problems, fungal infection problem. The last one is all those like questionable lesions on the feet is worth to pay attention to. So those are my top 5 things that I would like to share with everyone for the winter time. And of course, we're here on Facebook, Instagram, and other social media platform. You can always send us message. You can always reach out to us on our website. So if there's any questions, concern, it's just a simple question that if I can get back to you, I would do so. All right. And just one last thing to remind you, just follow us on Facebook or any social media platform so that we're going to have a pop-up contest from now until the end of the year. Every week we're going to have special prize with through the contest. All right.
Okay. Right. Yeah, we just have a few people that are checking in. Maybe you want to give them a shout out.
Okay, so let me see. Okay, so hello everyone.
I think we have Dr.
Yes, yeah, we have Dr. Kale. Yes, Dr. Kale is my colleague from Florida. Hi, Larry. How are you? And we have Velvet here too. Hi, Velvet. She's a very dear patient of ours for a long time. So, well, glad to see you here and hope you're doing well, Velvet. All right. So, all right. So, we are good. Any questions, Curtis?
No questions. We also have Dr. T on the check-in on Instagram, and
okay. Hi, T.
And we have a few other people on here, so thanks for viewing, everybody. Any last thoughts before we check out, Doc?
Yep, we are good. All right, enjoy the holidays, and don't let the foot pain ruin your holidays. All right, bye now.